This recording will go over cardiac catheterization nursing care. Prior to cardiac catheterization, patients should have a 12-lead ECG, chest x-ray, and coagulation studies. After the procedure, the child is positioned with the affected leg straight for 4 to 6 hours. Infants can be held prone on the parent's lap. Older children remain in bed with the head of bed raised at only 20 degrees incline. IV fluid administration continues until the infant or child is taking and retaining adequate amounts of oral fluid. Vital signs should be obtained frequently, every 5 to 15 minutes for the first hour, with continuous initial monitoring of heart rate, blood pressure, respiratory rate, oxygen saturation, and temperature. The insertion site dressing should be observed frequently, at least every 5 to 15 minutes during the early post-procedure hours. Assess for bleeding, not only on the dressing, but also on the sheets. Look under the child to check for pooled blood. Pull back bed linens and remove an infant's diaper, if applicable, to check the perineal area for bleeding under the skin. If bleeding occurs, place a gloved heel of hand firmly on the insertion site. Apply pressure for at least 10 to 15 minutes and assess distal perfusion of the extremity. Immediately notify the interventional cardiologist. Assess blood loss and the child's hemodynamic status. Peripheral perfusion is also monitored. The affected extremity frequently will be mottled in appearance and cooler to the touch than other extremities. Distal pulses should be palpable, although they may be weaker than in the contralateral extremity. Non-palpable distal pulses should be checked using Doppler technology. Notify the cardiologist if distal pulses are absent on the infected extremity, the temperature or degree of mottling has changed, or the child complains of increasing pain. Children who have undergone a diagnostic cardiac catheterization are often discharged the same day. Let's see here. Patient teaching or parental teaching, caregiver teaching for the child who has had a cardiac catheterization include inspecting the catheter insertion site to assess for healing or for the presence of infection. Bathing limited to a shower, sponge bath, or brief tub bath, no soaking, for the first 1 to 3 days after procedure. The child should avoid strenuous exercise for up to 1 week after the procedure or 6 weeks after a device is placed. The child can return to school on the 3rd day after the procedure. Notify the cardiologist if the child has a fever above 101 degrees Fahrenheit, bleeding or drainage from the catheter insertion site, or pallor, coolness, or numbness of the affected extremity. Resuming normal feeding patterns and medication therapy, if applicable. Reviewing the need to continue antibiotic prophylaxis for dental or other specific medical procedures. And finally, reminding the parents that following up with the cardiologist for scheduled visits is important.